are here with Dr. Robbie Burns, gynecologist and specialist in hormone therapy, and we will find out what's the difference between the regular hormone replacement therapy and the bioidentical hormone replacement therapy.
Okay, well, when we speak about hormone replacement therapy, we usually separate it into what's natural and what's synthetic or what's man-made. And when you alter hormones, you have to attach something different to it to sell it as your product or to get a patent on that product. And when they change it, it looks different to your body. Your body says, well, this kind of looks like estrogen. I guess I'll accept it into the estrogen receptor, but I understand that that's not really what it is. And that's where many of the side effects come from. When your bodies recognize that this isn't really what it naturally makes, but it brings it into the body as a substitute. Therapy. The biggest benefit is that you can customize it to yourself, meaning that not everyone needs the same amount of estrogen or the same amount of progesterone. And in the synthetic hormones, usually it's only those two hormones that are replaced. Our bodies make different hormones. It doesn't just make estrogen and progesterone. And when we go through menopause or perimenopause and our bodies start to change, we need to replace different hormones. Okay. Sometimes we replace testosterone or DHEA. Some people might be familiar with some of these other hormones that our bodies require as well. And when you give those hormones back, your full wellness feels better. It's not just about getting rid of hot flashes. It's about feeling better, feeling younger, feeling more energized.
Mm-hmm. So this is the place actually to come to get rejuvenated.
Absolutely, absolutely. We don't believe here in growing old gracefully.
That's great. How about the medical insurance? Does it cover for the blood test and?
Well, many do. Initially, we like to try to use traditional blood testing. I know many people may have heard of saliva testing or different types of testing. We try to use blood testing first, in combination with symptoms. How are you feeling? What's going on with you? We have a symptom evaluation sheet, and then we usually do initial blood test to make sure it truly is just hormonal. And for that reason, most insurances do cover, including Medicare, because it's a wellness program. It's not just hormone replacement. We want to make sure your cholesterol is okay, that your body's in normal working function, your thyroid's fine. We also offer some nutritional testing as well to make sure that your calcium, your vitamins are in good working order, and we don't need to replace those as well.
Actually, for our sex life.
Absolutely. That's really what our bodies, when we talk about kind of feeling 50 versus feeling 30, what is the signal to our bodies that we even got older? And a big signal to our bodies that we're aging is the decrease in hormone. In women, we decrease our testosterone as well, and those same problems exist. When your testosterone goes away, you notice, wait a minute, my arms are moving a little bit differently. That muscle tone, even though I'm lifting weights and I'm working out, I'm getting a little bit more weight in the middle, and that's a big part of that is our lack of estrogen and testosterone, as well as the sex drive. I mean, part of the estrogen moisturizes our bodies and our skin, and the testosterone will contribute to the sex drive. And when you lose those things, there's a lot of things that go into sex drive. That if you're gaining more weight in the middle, if you don't feel as attractive, if your skin is drier, you're not as interested in sex. And if we can replace those things, then I think our self-esteem as well as our sex drive will increase.
Well, this is truly a place for women to be pampered and get younger and healthier, and it's only 10 minutes from Sun City Anthem. This is Sophia from Channel 99.